Hey everyone, this is my presentation on asthma. We will be discussing the etiology of asthma, risk factors for the chronic disease, structures involved, living with the diagnosis, and the current prognosis. So what is asthma? Asthma is a chronic condition that affects the bronchial tubes of the lungs. These bronchial airways are important in transporting air to and from the lungs to stimulate breathing. Individuals with asthma may experience periods of wheezing, coughing, shortness of breath, chest tightness due to inflammation and narrowing of the bronchial tubes. If these bronchial tubes become narrow and inflamed, the amount of air that can go in and out of the lungs is reduced, which creates those asthma symptoms. Current triggers for the chronic disease can be tobacco smoke, dust mites, pets, mold, outdoor pollutants, grass, and respiratory infections. I have a short video on what the bronchial tubes actually look like during an asthma attack. And you can see here irritants going into the bronchial tubes. The outside is made of smooth muscle, so they're able to contract and release. So if they do come in contact with a trigger, inflammation occurs. And you can see that with the redness that's going here. And then the smooth muscle is going to constrict and reduce that airflow from coming in and out of the bronchial tubes. So the structures involved in the respiratory system, the first step is going to be the nose. The nose's job is to warm and filter the air to pass through the nasal cavity. Once it goes through there, it's going to go past the larynx and down the windpipe. It meets the trachea, which is the cartilage structure that divides into right and left bronchi. And then the bronchi are going to be the hollow tubes within the lungs that are going to support the airflow. And branching out from the bronchi are going to be the bronchioles, which are thin, hollow branches of bronchi that contain those smooth muscles, which was in the video that we just watched, that can contract and release to support airflow to the alveoli. But in the case of an asthma attack, is going to constrict and restrict that airflow from getting to the alveoli. And then the alveoli are going to be clusters of tiny sacs that are surrounded by capillary blood vessels to exchange oxygen and carbon dioxide within the lungs. So the risk factors for the disease, as you can see, it can be a plethora. Environmental or occupational hazards can occur. So this can be exposure to bacteria, viruses, or fungi. Prolonged exposure to chemical irritants or industrial dust. These are those individuals that are like construction workers working in chalk mines, coal mines, and they're continuing to inhale all those dust and irritants from their occupation, which creates irritation in their lungs. And also poor air quality, pollution, pollen, and dust is a risk factor for asthma. Genetics can play a role into if a person is more susceptible to asthma or not. If you have a parent that has asthma, you are at an increased risk of developing the chronic disease yourself. And from my research, it seems as if your mother has it, you're more likely to be diagnosed with the disorder. Pre-existing conditions can also make the conditions worse. Any occurring allergies that you currently have cause like an inflammatory reaction within the body, which can induce those bronchioles to constrict and cause those asthmatic symptoms. Obesity, carrying extra weight onto the body can reduce your body's immune response and therefore your ability to respond to certain triggers that may induce an asthmatic response. And then repetitive respiratory infections such as bronchitis, the flu, pneumonia can put you at an increased risk of having asthma. Race and ethnicity can also come into play. People of Hispanic or African American heritage are at an increased risk of being diagnosed with asthma versus those that are Caucasian. And children that are African American or Hispanic actually have an increased mortality rate from an asthma attack. Gender can also play a role in the adolescent phase of life. Boys are actually at an increased risk of having asthma versus females, and then that idea is actually reversed in adult life. Females are actually at an increased risk of having or developing asthma versus males when they're older. Physical activity can come into play. Some individuals have physical activity or exercise-induced asthma, and this is when the bronchioles are going to constrict during strenuous exercise. So how is asthma diagnosed? There currently is no screening process or prevention for the chronic disease of asthma. Individuals are usually diagnosed after like a physical exam. The doctor may check your breathing, listen to your lungs, and may ask you some questions and look for symptoms of asthma. However, there are some tests that can be performed to see if the current symptoms that you are having are related to asthma. So, spirometer or spirometry test is going to measure the volume and the speed of air moving in and out of your lungs. If you work in a hospital, you've probably seen some of your patients have it on like their side table. Doctors usually tell them to breathe in and out of this tube to move like the little it's almost like a button within the machine to move it up and down, trying to expand those lungs and see how much volume you can get in and out. And so that's what that test is going to be. The bronchoprovocation test is actually pretty cool. It's going to measure your airway and seeing how it reacts to certain irritants. So it may expose you to potential asthma triggers and see how your body responds to it and how your lungs respond to it. And so your spirometer or spirometry test is usually done after or within the test to kind of measure that volume. And so the peak expiratory flow, or the PEF test, is going to measure how fast a person can expel air while using maximum force. The FeNO test is your fractional exhaled nitric oxide test. That's a mouthful. And it's going to measure your level of nitric oxide in your breath when you're breathing out. And then an allergy or blood test can check to see if your body responds to certain irritants that could be a potential trigger for asthma. And so diagnosing children that are younger than 6 years of age can be very difficult because you can imagine it's hard for children that young to even perform some of these tests on their own and get a reliable answer. So the current statistics are here according to the CDC. This is just the national prevalence of the disease, and you can see the percentages kind of average between child and adulthood, going around like the 7-point mark as far as percentages goes. But if you notice in the age group, it's mostly prevalent in individuals ages 5 until 20. And so these are your onset symptoms. So the current treatments for asthma, you can have long-term medication or you can have short-term relief. So your short-term relief is going to be your inhalers, which contain your short-acting beta 2 antagonists, and those are going to try to relax those tightened bronchioles so they can increase the airflow within your lungs. Corticosteroids are there to reduce the inflammation, and those can be taken orally or can be through intravenous fluid. And then short-acting anti cholinergics are going to attack the anticholine in the body, and it works as opening the airways quickly, but it is less effective than the beta 2 antagonist inhalers. But usually they're used for people that cannot tolerate those beta 2 antagonist inhalers, like mentioned before. So your long-term medications can include the corticosteroid again, trying to reduce that inflammation. It can have leukotriene modifiers, which that's also reducing the inflammation in the body and opening the airways. And usually the corticosteroids and leukotriene modifiers are taken together. You can have mast cell stabilizers, which those are trying to attempt to attack the allergens first when they enter in the body, so the body doesn't have an inflammatory response, and therefore preventing those bronchioles from constricting that airflow. And then you can have long-acting inhalers and bronchial dilators to use for long-term use. And then others find relief in allergy shots, trying to prevent, again, that inflammatory response from potential triggers. So the prognosis for asthma is really well as long as individuals are aware of their current triggers and they keep their medications accessible to them at all times in preparation for encountering certain asthmatic triggers. And then I also included just a little bulletin on COVID-19. The CDC currently recommends individuals with asthma to take extra precautions against the virus because the chronic condition does place them at a higher risk for complications. So the CDC also has an action plan to reduce major asthmatic flare-ups, and this action plan kind of goes along with like stoplights, green, yellow, and red. So in the green zone, a person is seen to be doing well. They're not having a cough. They're not having any symptoms. They can perform their day-to-day activities as normal. And if they're using a PEF meter or spirometer, they're around average or like above average, and they can continue taking their long-term medications because everything is going well. If they're in the yellow zone, their asthma is getting a little worse. So they may experience some of those symptoms like the cough, the wheezing, the chest tightness, or the trouble with breathing. They may wake up in the middle of the night because of their asthma. They're having trouble doing those day-to-day activities, and their PEF flow is going to be a little less than average from their normal. They are finding relief from those short-term medications, but they still need to continue using their long-term medications. And if those symptoms resolve, they still need to come back and check up on those symptoms and not ignore them. However, if they are in the red zone, that is a medical alert. And this is when a person is having trouble breathing. They can't find any relief from short-term medications or their long-term medications. They're having trouble performing all of their daily task, or they've been in that yellow zone that we just mentioned for more than 24 hours, and everything just seems to be getting worse. Their PEF flow is less than average, and the medications are currently not working for them. And so if that happens, they need to seek medical attention as soon as possible. Because although the prognosis for asthma is good, severe asthma attacks can be fatal. All right, and these are all my references for my presentation. So if you have any questions, please leave them below and I will try to get back to you. Thanks.